Well, health professionals in the Tennessee Valley say they are starting to see a rise in respiratory illnesses in kids and teenagers.
And with school back in session and more holiday events, doctors say this is not uncommon, but they also say there are things parents could do to try to keep their children from getting sick. Local 3 Xavier Harris spoke with a doctor in town about the options.
Vaccines can be a big help with some respiratory illnesses. It helps prevent severe sickness and even death. Dr. Matt Hitchcock says while vaccines can help with the flu, he says to help other respiratory issues, that starts at home.
I think the biggest thing, make sure that the kiddos are washing their hands.
Just this week alone, Dr. Matt Hitchcock with Hitchcock Family Medicine says he's seen several kids coming in with some type of respiratory infection.
The main symptoms, cough, fever, nasal congestion, that's the biggest symptoms that I'm seeing.
He says while the typical flu season sickness hasn't arrived yet, around this time, it isn't uncommon to see an uptick in respiratory infections in children.
Like clockwork starts when school starts back. Usually a week or two after school starts back, you see a spike in the respiratory illnesses. And that's just the kids coming together. Like I said, especially the younger ones love to play, touch, hug, share things, and including germs.
He says by the time a child is sick, healing options are limited, but there are some things you can do.
Big thing, a humidifier in the kids' rooms can sometimes help, help them kind of blow their nose for the older kids, or in the younger kids, the bulb suction that they came home from the hospital with, or some nasal saline to kind of help break the gunk up in their nose and suctioning that out. That's huge.
Dr. Hitchcock says COVID-19 cases have been creeping up lately, and the influx may get worse as students are headed back into the classrooms. He adds vaccines can be very helpful as it's hard to tell the difference between respiratory infections and COVID-19.
On its face, without a swab and a test, you're probably not going to be able to tell it apart. Right now, probably about a quarter of these cases I'm seeing are testing positive for COVID, so definitely seeing some COVID out there. But at this point, it's almost identical to the normal colds and those kind of things that I'm seeing.
Because of these concerns, Dr. Hitchcock is encouraging parents to get their child vaccinated. He says parents who don't trust or worry about vaccines should have these discussions with their doctors. Reporting in Hamilton County, I'm Xavier Harris, Local 3 News.